Hey guys, welcome to episode 8 of the Heart of Medicine interview series. We're super excited today to have Lillian Pearl Bridges as our guest.
She's one of the world's leading authorities in Chinese face reading.
Yeah, and she specifically focuses her face reading on Chinese medicine and health. And of course she also uses it to help further businesses as well. But she does also bring it back to classical Chinese medicine as well. And so this is something that we don't learn at all in a university degree, but it's just so rich in its classical nature.
Yeah. So it was really interesting to hear her story, how she came around to it learning from her grandmother very early on, from 5 years old. But it was never something she thought she would do as a profession.
Yeah.
And then the research that she's now gone into, researching through all the classical texts, matching it all up, and looking at modern research and trying to link things together. She's taken a very sort of scientific approach to it, which is good to see.
Yeah, because, I mean, she said her grandmother, the way that the grandmother taught was in this holistic way. She had to dissect it all and find out the reasons why and link it together. And make it more scientific and more rational, if you like, to enable to teach it to other people. But it's just fascinating, like, I'll talk with her and she talks about the concept of the original face, which she will explain.
Yeah.
And by returning to the original face, which is basically our innate nature and what we're here to do,
we can find our, as she refers to it, our golden path, which is a deeper sort of individual purpose. It was interesting. She takes a very scientific approach, but then on the other hand she's linking it medicine to a much deeper level than just looking at the organs and imbalances. She's helping people find that purpose, that drive, that's it. And she talks about the concept of transcendental emotions. So we all know the 5 emotions are related to, the 5 elements in Chinese medicine, but she takes that one step further because often we can have excess emotions, which can sometimes turn pathological. And so by having these transcendental emotions aligned with each, she almost uses them as like a prescription.
Yeah.
So if you've got a pathological emotion, she'll use the transcendental one as a prescription to remedy that.
Yeah, that's it. And bring yourself back to center. That's it. So anyway, this was such an enriching conversation we had with her, and
very jam-packed. It's only 20 minutes.
Yeah, that's it. So we really hope you guys will enjoy it as much as we've had interviewing her, and we'll see you in the next episode.
Enjoy. Welcome, Lillian. Thank you for taking the time this morning.
Sure.
You've had a pretty big weekend, and everyone really, really enjoyed your seminar of the weekend.
I'm glad.
I think everyone got a lot out of it. Yeah. So you were saying, like, a bit of your background. You started learning face reading very early on from your grandmother.
Yeah, I started at the age of 5. She read just about everybody who came in the house. Actually, I think she read everybody who came in the house. And every time she saw them. So she was a very busy woman. She was a businesswoman. And she did a lot of good. She actually read people's faces for personality, for health, for relationship. And I sat by her side and watched her read my entire childhood and young adulthood. So it was great.
Yeah. So how did you come to doing what you do now?
Well, I wasn't intending to become a face reader. I in my family, pretty much everybody reads faces of the older generation, so all my aunts and uncles do it. Yeah. And I just adored my grandmother, so I just hung out with her most of the time. And I didn't think it was unusual at all until I got married. I was going to get married, and I had to bring my then fiance to my grandparents' house. And he got read by everybody, and he was actually blown away. And I was actually in a master's program at the time for writing, and he said, "You ought to write a book on this." And I went, "Oh, that's a good idea." And so that's when the book started. And it was a long time ago. And then I realized how hard it was to write a book about it, because when you learn in a holistic way, as my grandmother did it, she didn't say this means this and this means that. And it's a very Western way of looking at it. She just gave this kind of overall consultation where she said all these things. And I had to say, well, why did you say that? And why did you say that? Yeah. And so for me, the hardest part was pulling it apart and figuring out what meant what and why.
So you had to make the linkages yourself.
Yeah, and the why was really critical, especially when it came to health, because my own interest, of course, is very much in health. And she did health things, and trying to find studies that matched it in Western world, and trying to find ancient texts that matched. And to me, it's very clear Chinese medicine has always had face reading in it and diagnosis in it, but it kind of got separated a little bit. So I'm trying to bring it back.
Okay.
Yeah.
We both have your book.
I'm glad.
And I was sort of reading at it, and you mentioned something about the original face in the very, very beginning. Can you elaborate a little bit more about that?
Well, that's a really ancient Daoist term. And the original face, and what's exciting about it is the most ancient pictogram that I've found so far is a face running on a path. Yeah. And that face is literally a face with eyes, nose, mouth, and a shock of hair sticking straight up like antennas. And I think it's really about getting to know yourself really, really well. And I think when you get to know yourself and all of who you are, which includes your inheritance and your talents and your personality and all that, then you have a much easier time living in the world, because you don't do projection, and you don't judge so much. It's like you just know who you are, and you kind of accept other people for who they are. And I think it's a very conscious spiritual thing to understand your original face, who you really are.
Yeah.
And then it helps you figure out what you're supposed to do.
Yeah.
Which I call the golden path.
So can you go a little bit on about that? So how do we find who we really are, I suppose? Because that original face, because we look at ourselves and know, like, okay, what do I look for? Like, where do we start?
Well, it's not just what's there, too, because in actuality, there's so much more that we are than we show, and so we can actually alter ourselves rather easily, I think. And to me, the face is kind of holographic. So whatever's going on inside is going to show up out here. And I think in terms of getting to know yourself, experience teaches you a lot about how you act, about what happens. I mean, when you're called in a crisis to behave in a certain way, it's fascinating to see the variation in human behavior. It's like, why did someone act that way and why does someone else act that way? It's like, for example, true heroes are not present in everyday life. They're only present when there's a emergency, situation, it's a crisis. Yeah. And so that person may find out, wow, I'm more courageous than I thought, or I'm braver than I thought. And I think we get tested, and I think in being tested, we find out a lot about who we are, and then our face starts to show it. So we have some choice. I mean, not a lot. We have some choice, I think, in how we look, how we behave, and the original face is really about what do we have? What is in there, and when it's called to come up, how do we do? And it's not a judgment, not good or bad. It's just that what is in there, and how can we access it? So I think the face is a entry point, entry point to the psyche and to the emotions, and to me, your face mostly shows at the moment, whoever you are, how you've been. So, pretty easy to tell how someone's lived.
Yeah. Well, Gavin is 23, recent age. 24.
Yeah. So in your book, you said you should steer away from doing a full
face reading. Yeah. And the reason why is I don't want to make anybody stereotyped. I don't want to make them think this is the way they are. And when it's who they are at the moment, and it may or may not change. Sometimes, I think until you're about 25, you try on different.
Changing.
Yeah, you try on different clothes. It's like, hey, I want to do this for a while and that for a while. 25 is very simply the time in Western science where they talk about the brain finishing development.
Okay.
The Chinese somehow knew that was the case. Yeah. You got more set at that point. But even then, even after 25, you're not set. So I try to have people understand that we're very malleable. We're very adaptable. I don't like to use the word change. I don't think you change. I think you become either more of who you are or you grow. But I do think that you have some ability to work with that. And you might find yourself being, for example, way more conservative than you thought, once you have kids. That's one of those things you find out. It's like, well, I'm really liberal until I have children, and then I'm going to act differently.
As your circumstances change.
Absolutely, yeah.
Yeah. So then how do you kind of know like your golden path that you were talking about before, what you're here to do.
Yeah, well, the golden path, it's a little bit complicated. It depends how old you are. It's like, you two are very young, and so you've got a lot of opportunity, and you've got a lot of choices that you could make that could steer you this way or that way. And when you're older, you have less and less choice, but in some ways, it's easier to find your path because there's so many things you've tried that didn't work, So the golden path is simply, it's what the Chinese call virtuous action. So if Tao is the original face, then Te is virtuous action. How do you do, virtuously, who you are out in the world? And so it's not really about a job. It certainly can't say, I'm a lawyer, I'm a doctor, I'm Indian chief, that's whatever. Right. That's not actually what the golden path is. The golden path is an I am statement. It's I am me, and here's what I can do, and here's how I can do it in the world. And so it's really a matter of figuring out what you can do, and doing it. And by the way, that being said, it should start out easy, and then it gets harder, but then it gets easy again. So, so if it's the right thing, originally it's like, wow, this is great, and then you have to hit a few roadblocks. But
yeah. And I really sort of resonate with you on that sort of, on that kind of what you were saying. Just a little bit about I grew up in a family where mum and dad are both martial artists and they teach Tai Chi.
Wow.
And why I was so drawn to face reading was because Dad always said, there's a lot you can tell from the face.
Oh,
you can tell many, many, many years. But he obviously didn't delve into that area.
Yeah, but he knew, as most Asian people do. Yeah. They know something about it.
Yeah, yeah. So, when I was young, I was always surrounded by a lot of Buddhism, Taoism, blah, blah, blah. Those seeds were always there. So
how lovely.
Somehow that was always kind of like, wondering this and that. And so, when I went to pharmacy at first, as a first degree, a lot of that didn't kind of sit in with me that well.
Missing the spiritual part of it, I think.
Yeah. And then afterwards, I said, no, I need something more holistic, and hence why I started Chinese medicine, and that sort of sank in really well. And I thought, okay, that's part of it that was missing. I kind of found.
Well, yeah, and I think it's part of Chinese culture. Almost everybody of Asian descent, I should say, knows something about it. Some more than others, certainly, but it's pervasive. And to me, I think what we forget in the West is that the Chinese were natural scientists. I mean, they observed and observed and observed. And it's not very complicated. It's like I talk about pain lines, for example. You get pain lines from wincing. If you wince long enough, you're going to get those lines, and they're going to stay there. So it's very easy to see. Well, yeah, if you do that, then it's going to make those wrinkles, and that means that you're in pain or you have been a lot. So it's really natural science, and it's not actually as esoteric as it sounds.
Yeah.
And I think the connection that they all have always had between the emotions and the physical health has been there, and for them, for Chinese medicine, there is no separation between the mind and the body. It's like it's all the same. There's no different.
Yeah.
It's like where's the cutoff? It's like where's that little switch in your neck that says, hey, no, this part and that part don't mix. So they connect that and always have.
That's right.
And that's what I think is so valuable, is that you get a much better perspective on some of the causative factors of health conditions, and you can understand that there's some responsibility that you have. It's not just oh my goodness, I lived in this bad environment and was around people spraying their orchards. It's actually much more than that. It's also about what you eat, and it's about what you feel. It's about how you've lived, as well as the genetics. So there's a whole combination, and to me, the face gives you access to the part that you have some control over, and that's how you act and react to everything that happens to you. So I like having a little a little ability to move things.
I remember one thing you said over the weekend that really sort of stuck with me was. So you don't practice Chinese medicine per se,
no
acupuncture or herbs or anything, but you said that your questions are like your acupuncture needles.
Yeah, my students call me a psycho-spiritual acupuncturist.
That's so cool.
I use questions. I think questions are underrated as a medical tool. It's like it's astonishing what you can find out when you ask a good question. And a good question to me means, first of all, no judgment. A mild curiosity, but no predatory energy. You're not trying to dig something out of someone because people feel attacked. But you just ask with mild curiosity and interest about a person, and it's quite astonishing when someone's answering how much they can release and learn from their own answers. They even find themselves saying something if they're asked something that they didn't expect to say. Or tears will come up, which I think I'm really good at making people cry temporarily. Because I do work with a number of students of mine in the Master Face Reading Certification Program, I've got a number of students now who are practicing in clinic using the face reading a diagnosis along with their acupuncture treatment. And I've gone with them to clinic visits and work with them in their clinic. And, if I ask a question and then they decide how to treat based on that, it's really astonishing to me how much that question brings up that allows the practitioner to figure out what points are really needed, what organs really involved, because it might be different than you think.
Yeah.
It might be that you think, oh, this person has obviously this liver problem because they're angry or whatever else. You ask them the question, they start to cry. Well, yeah, tears are the liver, but they're crying because they hurt. And the anger may be that defense mechanism, but to protect against the hurt. And you really ought to be treating the heart instead of the liver. I mean, that's the kind of thing I'm talking about, where you get something else by asking.
Wow.
Yeah, I've noticed sort of, at least in our early stages of nutrition, there still seems to be a focus on the physical side of things. Like we're treating a lot of things almost like from a Western point of view, but just in Chinese medicine language, like we're treating liver patterns, spleen patterns, whatever.
Right.
But we're not going to that sort of higher level and really addressing the person in there.
Well, I saw a funny sign in Los Angeles. We were driving by somewhere, and this guy said, the sign said, "I want to meet your kidneys." And it was a Western doctor, and then it was the kidney specialist, and I kind of went, wow, what about like the rest of the person? He just wants to see kidneys, and I just started laughing really hard because that's sometimes what happens is that you end up seeing patients as the problem. It's like, wow, look at this liver pathology, or look at that kidney pathology, and you forget there's this whole human being involved, and I think that's where the true magic of medicine is working with that complicated person, and figuring out what it is that they've done to to live in ways that increase this or cause that. And so I like to work with the mental emotional stuff, psycho-emotional stuff, and I think Western medicine's following along too. I think that we're seeing more and more studies showing that this personality goes along with that disease, and this kind of behavior goes along with that disease. So they're starting to do more and more research, which makes me very happy.
Yeah,
Every day I find something that I post on Facebook and go, look, this shows that that emotions are involved.
That area of Western medicine is still quite young.
It is very young, and you got to remember, face reading's ancient. It's 5,000 years old.
Yeah.
So.
I remember the other segment in your book that really caught my attention was when you talked about the 5 elements, and you've got pathological emotions in the 5 elements, and the transcendent ones.
Well, they're not really pathological. They're really more just human emotions, and human emotions are just what we use to interact on a daily basis. We need them, and I think the problem is you can overuse them and underuse them, whereas the transcendent emotions are kind of the more spiritual level, and you read the book well. That's what I'll get there right away. The transcendent emotions are really amazing, and my grandmother taught me these kinds of things. And there's a very specific story that I could tell you, and that is she had a child, die in her arms because she didn't have money to pay the hospital up front, and the baby died. I mean, right there at the hospital, and I was incensed thinking that my aunt had died like that. And I asked her why she didn't have more markings about that particular incident. And she said to me that she really looked at the whole situation from above after a while. At first, of course, she's furious and wants to do whatever she could to harm those people who harmed her child. But she said over time she realized that it was one of the most significant experiences in the family history, and that it made her so much more close to her children who came after, and the ones who were already there, and that it brought her into a more spiritual place, and so that she found that experience was formative in her spiritual growth. And I was blown away by that you could rise above it, look down at it, and think of it differently. And so she's the one that taught me about how to do that. I mean, I didn't know how, and I'm still not that good at it, but sometimes. And you rise above it and look at it and kind of go, wow, that was really important, that was really good, that was something that changed my life, even though it was hard in a way that now I can look at and say, I'm glad it happened, even though you don't want to relive it, but you're still glad that it happened because of the experience that what you learned from it. And so that's how I started learning about the transcendent emotions, and it's really about how do you get to a place where you can look at things differently. And so that's why gratitude is so important in grief. When you think about grief, it's always about what you've lost or what you're going to lose, and it's always about these attachments. And if you do a kind of a bit of a spiritual detachment, that helps. But even more important than that is, how can you say, look how lucky I am for what I have right now, and get back in that present moment. And then everything's good. It's like no matter how bad it used to be, or how bad it may be, you know, next week or next month or next year, right now, hey, you're doing pretty well. And that ability to stay in the present moment is something I think most spiritual teachings try to attempt to have you do. And gratitude is like an instant way of getting back into the present moment. It's so cool.
Yeah. That's very true.
So can you almost, in a way, sort of prescribe these transcendent emotions to help?
Oh yeah, I work with them all the time. To me, if I'm working with anyone with any disease, I will use the transcendent emotion of that organ to help them rise above, you know, whatever it is they've been feeling. I mean, to give you an example, Chinese don't talk about love that much, honestly. They don't. But they do talk about one kind of love, and what they talk about is parent to child. And what that really means is love your child as it is you. But what people forget is that means you love yourself. And so loving yourself is actually in Chinese medicine, but no one really talks about it. And whenever I have someone with heart disease, I go right there. It's like, why don't you love yourself? Why don't you let yourself give love or receive love the way that you actually deserve and want? And I think love becomes a really healing emotion for heart disease.
Absolutely.
You know?
Yeah. On that note, like, I remember when I was young, Dad used to sort of give me, like, you know, 10 little words, and then it was all surrounded by this notion of self.
Yeah.
So 字, right? And then he'd say, you know, 字, and then 尊, it's like respect, and then 尊爱, and then it's, you know, love, and then 信, and
good training,
and then it's belief, and then 尊, and then 自信, so that was belief, and then 自立, which was independence.
Oh yeah, that's part of my name. That's part of my name.
Oh, is that the name?
That's part of my name. Independent lotus blossom. Yeah. Lillian.
Yeah. Oh, right. And then I was like, which Li is it? I was like,
Li is independent, so I know that one.
and
upright lotus blossom.
Yeah. Nice. and I also recognize the proverb that about you know, the blossom, so the lotus not touching the mud.
Yeah,
even
coming out of the mud.
Yeah.
That's my Chinese name actually.
Yeah. Well, that was one symbol that Father sort of kind of told me.
It's a good one. Like, very classic, and to rise out of the muck, you know. And someone told me something else yesterday I thought was really profound. And she said, you know, life's like a great big oil slick. And she said, you're like the rainbow on the surface. And I go, okay, I'll take that.
I'll take that.
We can find beauty everywhere.
Yeah. So how do you steer it in your clinic? So if you can see someone with very, you know, emotional issues, how do you steer them along to?
Well, I don't treat. I don't treat in any way. I just validate. I actually help people know who they are and help them figure out where they want to go, and you know, take a look at why certain things have happened in terms of illnesses or health conditions. I send them to somebody else. I send them to therapists. I send them to acupuncturists. I send them to, you know, chiropractors, whoever it is that I think might help them. And mostly what I do is help people express who they are. I think that's what's really critical for me. And so, in terms of treatment, I think that's actually a kind of treatment in and of itself, is accepting someone for who they are. You know, it does matter who they are. I can find something to really appreciate. Actually, a lot of things.
And you find that approach trickles down for them into the physical realm where they might have diseases, or? I
think so. I think that most of us know what's wrong with ourselves. I think we're our own worst critics, and we take in way too much judgment and criticism from our childhood. And you know, having somebody validate is quite a healing experience, and then to accept after validating. So you know, it's one of the other reasons why people cry with me is because they feel seen, and they feel seen in a way where no matter what they tell me about or show me, I accept it. And sometimes people letting go of those secrets alone can actually help heal, because that's something that's underneath some of their conditions. So yeah, face reading is really cool. That's all I can say. It's a wonderful way of working with people.
Yeah, great. Well, I think we have to get you off to your next appointment soon.
Yes.
But, to sum up, you had a really nice part towards the end of the book where you outlined a few rules that you sort of abide by. And it sort of like really struck me as like, this is a responsibility you take on when you see people.
You know, I was trained in psychology, and I do remember that there were rules there, and I kind of want all my students to remember that people, people's psyches are precious, you know, and when you're working with people, it's really important to honor who they are and to and to suspend judgment, and to be compassionate, and to do all those things that are healing, and then people are helped so much. And so I really I do have a code of ethics, so to speak, for face reading that I live by, and I teach all my students that as well. So. Thank you. Thank you very much.
Thank you, Lillian.